So you have an abnormal pap smear. Now what? It's time for a colposcopy. What exactly is a colposcopy? A colposcopy is a closer look at the cervix. When we do a pap smear, we just get a little sampling of cells, but the colposcopy allows us to get some tissue. That tissue is sent to the pathologist, and the pathologist takes a deep dive to see, are those cells just slightly abnormal or are they something more serious? First, let's talk about the steps to a colposcopy. The first thing we do is set you up on the bed just like we would for any other exam. We place the speculum in so that we can actually visualize that cervix. Once that cervix is nice within our sight, we actually take these swabs that have been soaked in a vinegar-like solution and we actually place them against the cervix for anywhere from 45 seconds to a minute. After the vinegar has stained the cervix for that period of time, we then take a close look with my microscope and I actually look at every quadrant of the cervix. What I'm looking for are changes to the cervix that have a whitish appearance. I'm looking for blood vessels that may have popped up with that vinegar solution. I'm looking for gross abnormalities to the cervix. And when I mean gross, I don't mean just bad looking. I mean something that I can see easily that I didn't need a microscope in order to identify. If you've ever had a colposcopy before, you may have heard your doctor say out loud, 1 o'clock, 2 o'clock, 5 o'clock, 8 o'clock. Many times we're actually looking at the cervix as if it were numbers on a clock. And we look at those areas to identify if there were any changes that were made with that vinegar-like solution. Some doctors actually place an iodine-like solution against the cervix. You know, that brownish looking solution. And we place that there for a little bit, remove it, and then we take a look with our microscope. You know iodine is brown, so if the tissue stayed brown, it's okay. But if there were areas that did not take the dye and they look yellow, that's an area that needs further attention. Further attention means biopsy. Now, if you paid attention to my IUD video, then you know that I try to do everything I can to keep my patients as comfortable as possible. One of the things that I do is to use the same hurricane gel that I use for IUD procedure placement, take a little bit of that gel, and then I actually place it against the areas that I intend to biopsy. I let it sit there for about 1 to 2 minutes. One of the ways we biopsy is using something called tissue biopsy forceps. What we usually do is place it directly against the cervix. In my case, I'll place it in those areas that I numbed with the hurricane gel. Take a big pinch in and then pull away. We biopsy each section of the cervix that either did not take up the brown dye or turned white with the vinegar solution. Remember that cervical os, that little hole right there in the middle of the cervix is almost impossible to see down there. And there may be cells that are within that os that could be our problem. This is where this comes in. It's called a Kevorkian curette. We actually place it inside of the cervix in the os, and then we just kind of run it back and forth until we pick up a few cells. Sometimes we'll take that same little endo brush, the kind that we use to get your pap smear in the first place, and then we'll place that in the cervical os. And we just do it a little more vigorously than we used it when we obtained your pap smear specimen. Those samples are sent off to the pathologist, and then they let us know what the final outcome is. The pathologist will let us know, are our cells actually normal and maybe the pap smear was incorrect? Or are the cells still at the baby abnormal cells and we can halt them right where they are? Or are the cells actually puberty cancer cells, getting ready to be the big bad adult cancer cells, and we need to intervene quickly? The big take home is that if you get your pap smear, then you can find those cells sooner rather than later. There's no reason to die from cervical cancer in 2025. Get your pap smears, friends. Call your doctor today and schedule that appointment.